Hello everyone, I am Dr. Aparna Gopal Bhaskar. I'm a bariatric and laparoscopic surgeon practicing in Mumbai. I am associated with Sefi Hospital, Nama Hospital, Apollo Spectra Hospitals and Curie Hospitals in Mumbai and Thane. And today we will address a very important subject about weight regain after bariatric surgery. So this is one of the most common concerns that most patients have, that whether they would regain any degree of the lost weight after bariatric surgery, because this is a common experience with them, and they've all usually tried a lot of measures before they actually opt for bariatric surgery. And in most cases, all these measures actually, while the patient is on any such program, they lose a significant amount of weight. But once they stop the program, the weight comes rushing back. And this is a big concern with most patients, and they always want to know whether this would be the same story even after bariatric surgery. Now, before we address this, I think it is important to understand obesity. Obesity is a chronic condition, and it needs to be treated just like any other chronic condition, just like diabetes or hypertension or heart disease, which basically means that patients with obesity will need lifelong support and care. Bariatric surgery is one part of the treatment. It is not a cure of obesity, but yes, it does help to control obesity very effectively. But to be able to maintain this weight loss in the long term, it needs some amount of work. So, first thing is that patients must understand that bariatric surgery alone is not a magic wand that will lead to all the problems related to weight loss will be addressed only by bariatric surgery. Yes, it is a very powerful means to do that, but along with bariatric surgery, it is also important to follow a healthy diet and an active lifestyle. So, in the diet, it is very important to be cognizant about the kind of food that a person is eating. In the long term, it is important to avoid sugars. It is important to avoid any kind of simple carbohydrates, not to indulge in too much of fried food, and also it is advisable to stay off empty calories like alcohol, like sugary drinks, cola drinks, all those things. In addition to this, it is also very important to follow a healthy lifestyle, in the sense an active lifestyle, and 45 minutes to an hour of moderate activity at least for 5 days in a week is very important and goes a long way in weight maintenance after bariatric surgery. But sometimes we see that some patients, despite doing everything right, still tend to regain some degree of weight. And this is where the importance of follow up actually comes in. All patients who undergo bariatric surgery must understand that they need to follow up on a regular basis with their bariatric team. And usually the dictum that we give to our patients is that if you feel that you achieved a lower weight, say at the end of 2 years after bariatric surgery, and you maintain that weight, but at a certain point in your life you feel that the weight is gradually starting to creep up, and we tell them that if you feel that you've regained more than 3 to 5 kgs after achieving the lowest weight, whatever lowest weight you had achieved, you need to come back to us immediately. So that sensitization needs to be done, because then we have a few options through which we can actually address the weight regain. And of course, diet and lifestyle modification is at the core of it. But yes, there are certain weight loss medications also which are available, which can help a person to lose 3 to 5 to 7 kilos of regained weight. In addition to that, there are certain endoscopic therapies also which are available. So sometimes we see that the pouches are dilated after the surgery in the long term, say after 5 years or 6 years, or the anastomosis has dilated, the place where we join the stomach to the jejunum. And these can be rectified by endoscopic measures as well. Additionally, in rare cases where the weight regain has been very rapid, there are certain patients who may have responded to bariatric surgery well, but also maybe because the disease was very aggressive in them, they tended to regain the weight back quite fast and maybe to a larger extent. And these are the patients who may need more clinical evaluation, and probably they may form suitable candidates for a revisional bariatric surgery as well. But by far, if a person is following a healthy and active lifestyle, usually they are able to maintain their weight loss after bariatric surgery. And like I mentioned, it is extremely important to follow up after bariatric surgery, and that goes a long way in weight maintenance. So, in case you do feel that you have weight regain, please don't hesitate to get in touch with your bariatric team. Thank you so much.